Precious Ann Anunciacion. I'm a company nurse at a BPO company. I was referred by my friend Dr. Sakpa here on CSA due to my acne problems and acne marks. Don't forget to click the subscribe button and the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Today is a precious day because we have Precious with us. Welcome, Precious Ann. Okay. So our talk for today will be about acne vulgaris and acne scars or acne marks. Well, we women in our age of like 20s, 30s, even I, early 50s, sometimes you still experience like this acne conditions, acne problems. But for Precious, she's already in mid-30s. Okay, so she still has this acne concerns. Okay, and a while ago we were discussing about like possible causes of this one, like for her case because of like a hormonal imbalance also. These are one of the causes of having an acne conditions, okay? And if we classify the acne problem, it's already in the category of like a moderate, going to the moderate to severe, okay? Because we noticed already some cystic acne there. Actually, you were sharing with me a while ago that, like a week ago, you had this pustular acne on the chin area, right? And it has flattened already because we gave her some medications to control the active ones, the inflamed ones, the infected ones. And another problem with the acne, the overproduction of the sebaceous glands, okay? Yung mga oil glands natin, Precious, okay? If they produce too much of oil, too much of sebum, it will clog the pores and then will create those comedones and then eventually becoming like papules and then pustules, inflamed types of acne, cystic, nodular acne. Okay, so there are stages of this one. So starting from that overproduction of the sebaceous glands, active yung mga oil glands natin. And of course, these oil glands were triggered also by hormonal conditions, okay, the hormones in our body. Kasi mayroong receptors yung sebaceous glands that will be stimulated by these types of, specifically androgen hormones, okay? Merong androgen receptors kasi, okay? And then another factor will be yung mga dead cells, hyperkeratinocytosis. So, if they accumulate in the skin, in the superficial layer, they also will clog the pores. So, yung tinatawag namin mga keratinocytes, too much of those, they can also lead into blockage of the skin pores. And then, if you have this overproduction of the oil or more of the sebum, okay, we have some organisms that are present in our skin, okay? Yung Cutibacterium acne. They proliferate in number if too much of the oil, okay? The oil is parang food to this microbe, eh. So, they increase in number if there's too much of this oil, parang too much of food, okay? So, these kinds of organisms, they're in the skin and then too much of those sources of food, like meron kasing mga triglycerides in the sebum, tapos yung formation ng mga end products ng mga fatty acids, actually, they become irritants to the skin. So, if the Cutibacterium acne will digest via the enzyme lipase yung mga triglycerides, then nagre-release siya ng mga glycerol and fatty acids, nagiging irritant sa skin. That's why you also experience yung parang irritation, right? So, parang may kati-kati na, tapos redness, inflammation. So, these kinds of microbes, meron kasi silang parang metabolic reaction din. So, meron silang enzyme called lipase, yielding those kinds of end products ng mga fatty acids, causing irritation to the skin. And after that, of course, there's a microbe. Kasunod is inflammation. So, the inflammatory process, of course, our lymphocytes and some inflammatory cells, they will go into the skin area where you have those microbes and they will try to fight off the infection. However, with fighting off the infection, they release a lot of like mga inflammatory molecules. So, releasing na yan yung mga leading to formation na ng mga swelling, pain. Sometimes may cystic acne ka na masakit, di ba? Redness or yung tinatawag na heat. So, yan. Yung mga factors na yon, so yung oil production, yung dead cells, hyperkeratinocytosis, si Cutibacterium acne, si inflammatory process, ayan na. End product, the moderate to severe type of acne vulgaris. That's why our management also will be targeting those 4 pathophysiologic problems. Okay, so we have to give antibacterial to get rid of the Cutibacterium acne. We have to give something to inactivate the sebaceous glands. We also have to give something to reduce those keratinocytes, yung too much ng mga dead cells. And of course, calm down the inflammation. That's why our management, if you notice, why do we give mga antibiotics? Why do we give mga pinapahid na benzoyl peroxide, yan, the clindamycin, erythromycin, and then we give oral na mga tetracyclines, doxycycline. The reason is because of the microbe. Okay? Ang dami palang problems. Okay? Other ones, yung mga genetic factors. So if it is in your genes, it runs in the family, we can also inherit it. But then kasi it's a problem of teenagers, no, Precious? Yes. And hindi na tayo teenager. Okay? So, like, there's like a 20 to 30% that some individuals will retain this up to their late 20s and above. And mid-30s na. Ako, I'm 51. Sometimes I still get a single, like, acne problem. Something associated also with hormonal. Kasi we women, di ba, yung monthly cycle natin. So, hormonal. Now, diet kasi, they were saying indirectly. Okay? Yung hyperglycemic index diet. Too much of sweets, too much of fatty substances in your diet, okay? Although they're not saying it's a direct cause, but somehow in the pathway whereby some hormones na nare-release, they could be triggered also by this too much of sweets, okay? So, kung lagi ka sa mga chocolates, or, di ba? Fatty, greasy diet, yon. Well, it helps, of course. We want to avoid then yung too much of sweets, too much of fatty substances in our food, okay? Healthy lifestyle also, okay? And then they were also attributing it to stress, yung lack of sleep, yan, overwork ka, over-fatigue ka. So, it will increase your stress hormones. Ayan naman, hormonal aspect. And other factors, okay? Iba kasi like, yung lifestyle nila, like, especially teenagers, no, when they get home and then they fail to cleanse the face, so dirt's accumulating the skin pores. Those are also factors, okay? So, yung skincare habits natin. Oh, wow! So many discussions, okay? So, we'll be using a certain energy-based device to target those acne problems, as well as the acne scars, acne marks. What kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics returns. Okay, we're back. Precious, are you ready? Okay. So, assessing the face of Precious, okay, so we noticed comedones as well as this nodular acne. And she has the papular type as well, the inflamed type of acne, okay. So, we have on the forehead region, and we also notice some on the temple, and then mid-face area, nose area, and also the lower third of the face. And she also has on the like upper neck area or the jawline area, okay. And it's a combination of the T-zone and the U-zone, so she has both. So it's also the overproduction of the oil glands as well as a hormonal aspect of the acne problem, okay? And we also notice presence of the different types of acne scars, okay? We're seeing some boxcar scars, rolling scars, okay? And then when you stretch the skin, you'll notice some of the acne scars, when you stretch, they become shallow. And these are types of scars that we can manage with our lasers, and even chemical pills can work on that. If we have those deeper acne scars, we make use of subcision because they have some tethering bands, okay? So for Precious, we need some combination procedures because she has the combined or the different types of acne scars, okay? Precious, do you have any question? Wala naman. Okay. Kasi Precious, di ba, you're also with, or treating yourself with like hormonal medications, right? Because she had a history. So in the past, you had this irregular menstruation, and she's under hormonal treatment, okay? So if you notice, she also has this upper neck area. And she has a concern that there are times that there's like an itchiness, like a sensation of like irritation or allergic reaction. Heat sensation as well, which is part of the inflammatory process. And the thing is, this kind of acne problem, there's a combination of the so-called allergic contact dermatitis, because she had used in the past some whitening treatments, whitening soap, whitening topicals, right? And what happened recently is that she's already reacting to those kinds of like topicals, even cleansers. Diba, you use Kojic, and they don't work anymore. That's why when we have like cases of non-responsive already to first line of treatments like topicals, what we do is we already combine with oral, and we have already energy-based devices that we can already utilize to manage these kinds of problems. So since Precious has active acne lesions, it is safe to use our radiofrequency microneedling. So in our center, again, we have our Eladerm, okay? And Eladerm is our painless radiofrequency microneedling. It also has some of this type of pulse type of treatment, okay? So we love this because it has on its tip the vacuum, the suctioning effect, plus also the cryogas, or the cool spray, so that it's gonna be numb, it's gonna be painless. You don't feel anything, okay? So we have our tip here again, okay? So it has a color green already, meaning to say it's ready to fire, it's ready to for the treatment, okay? So Miss Glory here will be, it's a touch screen, so she's already touching some of the numbers there, okay? So if you can check what is our power. So we're using the 15 watts for her, and the depth of our needle will be 1.5 because we're treating acne as well as acne scars. Okay, so we've done multiple passes for Precious, so we're just finalizing in this mid-face section, working on the problem areas, okay? And our final shot, okay, so we'll show the result to Precious when CSA Medical Aesthetics return. And we're back, so we'll show the result to Miss Precious. Precious, okay, so we did the Eladerm, the so-called radiofrequency microneedling, and we'll expect some erythema or redness right now because, of course, these are microneedles. We were like using these micropins to go within the dermis of the skin, and we wanted to target also those fibroblast cells, you know, to synthesize new collagen, and at the same time heal those acne scars, and also zap those active acne lesions, okay? Because we have this Cutibacterium acne whereby it's also targeted by that thermal heat, okay? So, it is a microneedling with radiofrequency. Yung radiofrequency kasi, Precious, it's a kind of thermal energy, or it's a heat energy, and it's brought about by those so-called oscillating electrical currents with collisions of those electrically charged particles producing heat. Yun lang yun, okay? So, it's a microneedling with radiofrequency, okay? It's not a simple microneedling treatment only. It's not just those tiny needles, micropins, piercing your epidermis and dermis, but we were using something with a certain thermal heat so that the radiofrequency can also have a benefit on our skin, treating the acne problem as well as the acne scars, okay? Because, you know, yung acne scars, di ba, we have those depressed acne scars. And some of the superficial layers, okay, medyo nawala, di ba? Kaya nagkaroon ng depression. So, what we're trying to do here is to restore those skin tissue matrix and regenerate again our skin and look younger. And, of course, we wanted to improve the skin texture, the skin quality. And I know it's kind of like, of course, you feel kind of, it lowers your self-esteem with this kind of acne and acne scars, okay? And as much as possible, we wanted to have clear skin, free from acne, free from the scars, free from the marks, okay? So far, ano lang eh, you want to improve lang skin texture, okay ka na, right? And yeah, because skin quality is also an important component of having an attractive face, as an aesthetically attractive face. Yeah, yun ang goal namin ni Precious, right? Di ka nag-iisa, Precious. Actually, we had a lot of patients with severe problems of acne. Yung iba talagang a lot of acne scars and deeper acne scars, okay? And we did multiple treatments, combination treatments, and we were able to, you know, somehow improve the skin condition as well as the quality of life, okay? It's important also that we feel good about ourselves. When you look good, you feel good. Ayan. Pagpa-boost ng self-confidence, self-esteem namin ni Precious, okay? So, we'll still be doing follow-up treatments for Precious. We'll have sessions of this, okay? She'll be coming in for like after 2 weeks. She was able to tolerate the procedure. It was painless, right?
Yeah.
But you feel the micropins? You felt
Yes po.
just a little bit. But it was tolerable, okay? Totally tolerable. Because before the procedure, we still applied numbing cream, EMLA, or the lidocaine cream, and then we used the cryogas to somehow reduce any discomfort nor pain there. And we love Eladerm. It's a painless radiofrequency microneedling treatment. It targets acne scars, acne problems, even wrinkles, lines. So apart from the blemishes and marks from the acne, it's also anti-aging, also like improves skin quality, skin elasticity, okay? Or those conditions with like stretch marks, or even like we treat hyperhidrosis, yung excessive sweating with this Eladerm, okay? With the micropins, okay? Plus others with pigmentation problems. So this is safe for all skin color, okay? It's colorblind, as we've mentioned in the past. And a lot of benefits from Eladerm, okay? So we'll still see more of Precious. We'll follow her up and we'll be showing some pictures to really, you know, to prove the efficacy, or like find out if it is gonna really help the problem of Miss Precious here, okay? So thank you with the Eladerm, okay? Precious, any comment or like message sa televiewers? Anything you want to share lang?
I want to say thank you to Doc Contessa for having me this opportunity. Since, yun nga, sabi niya, nakakalawang self-esteem yung may mga ganitong mga acne. And then, so, thank you sa mga taong tulad niya na binibigyan ng opportunity to do the new treatment, Eladerm. Yeah. Please go to CSA to do this treatment. It feels good.
Thank you so much. Don't worry, Precious. Marami pa tayong follow-up. It's a journey, okay? It's not a single treatment only, because acne is like, actually, it's a chronic inflammatory condition of the skin. It's like an on and off problem also. And especially, there's like a hormonal component. That's why you're under hormonal therapy as well. Okay, thank you so much, Precious. Okay, and Sa lahat po ng may katanungan, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 09175044-268. Precious, meron ka bang social media account in case they wanna follow you or check on you?
Just follow me sa Facebook account, Precious Anna Fashion.
Yan. Thank you so much. And also, please do watch our other videos in our YouTube channel, Contessa Salvador. And salamat po sa lahat ng mga nag-subscribe at nag-like. So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.